Bismillahirrahmanirrahim. I'm Dr. Mohibullah Wazir, and the topic is the brachial artery. Look over here, please. This is the tunnel of latissimus dorsi. This is teres major. The brachial artery is the continuation of the axillary artery, and as soon as the axillary artery crosses the lower bud of teres major, from this onward, it is the brachial artery. And then this brachial artery descends downward, running along the anterior medial side of the arm, and then comes onto the anterior side of the elbow and passes deep in the muscles, and in the lower part of the cubital fossa, level with the neck of the radius, it divides into its two terminal branches. This is the ulnar artery, and then look, this is the radial artery. This is the course and extent of the brachial artery. Now, what are the relations of the brachial artery? Note, please. Note the brachial artery. Look again. This is the biceps. This is the coracobrachialis. All right. This is the biceps, this is the coracobrachialis, and this is the median nerve. This is the brachial artery, and this is the ulnar nerve. Note the point that the brachial artery, it lies along the anterior medial part of the brachium or arm, and it is superficial, not covered by any muscle. Laterally related to it is the median nerve, and medially related to it is the ulnar nerve and medial cutaneous nerve of the arm, lying one upon the other. The superficial one is the medial cutaneous nerve of the forearm, while the deeper one is the ulnar nerve. And then more medially to that is related, that is the basilic vein and the vena committant of the brachial artery to unite the axillary vein. Now, the median nerve lying lateral throughout its course, note, then it crosses either anterior or posterior, but usually anterior, from lateral to medial, and in the cubital fossa, the median nerve is now medial to the brachial artery. And the ulnar nerve, it lies medial and posterior to the brachial artery and run in the same but lying posterior to the medial cutaneous of the forearm. Then the ulnar nerve leaves this compartment along with one branch of the brachial artery, that is superior ulnar collateral artery. These two structures, the ulnar nerve and a branch of its superior collateral artery, that leaves the anterior compartment by piercing through the mediator muscular septum to come into the posterior compartment, and then lies over here. And then laterally related to the brachial artery, over here first is the median nerve, and then you can see it is the brachial nerve and the brachialis muscle and the biceps muscle. First it is the, again you can see related the median nerve, then the coracobrachialis, the short head of the biceps in the upper part. While in the lower part, laterally related is not the median nerve, but it is the biceps and brachialis. And in the cubital fossa, laterally related is the tendon of the biceps. And it is this tendon of the biceps which you can feel it over here in the cubital fossa very easily. And the pulsation of the brachial artery, you can feel just medial to it. And very easily you can take the blood pressure from over here. And note, this is the common site of the taking by putting stethoscope over here and taking the blood pressure just medial to the tendon of the bicep. It is the landmark to identify the brachial artery. Alright, it is superficial, it is not covered by any muscle. That's why you can compress it very easily in this upper part if there is bleeding in the distal part. Now, what are the branches of the brachial artery. Look over here, please. The branches of the brachial artery. Number one, in the upper part, there is one big branch, that is profunda brachial artery. And this profunda brachial artery is being governed by the brachial artery in the upper part below the axilla, and it runs along with the radial nerve by passing just lateral to the long head of the triceps, that is through the lower triangular space, and come onto the posterior compartment along with the radial nerve, profunda brachial artery. One branch is profunda brachial artery, which runs along with the radial nerve to the posterior compartment, which supplies the posterior compartment muscles, and I will discuss it separately. Then this brachial artery gives muscular branches to all these flexor compartments, that is through this biceps brachialis and coracobrachialis. And then it gives one branch which follows this ulnar nerve. This is called a superior ulnar collateral artery, which passes through the medial surface, posterior surface of the medial epicondyle, and take part over here in anastomosis around the elbow joint. Then another branch is being given over here, which descends downward. This is called as inferior ulnar collateral artery, which passes interior to the medial epicondyle and take part in the anastomosis over here. These arteries, you can see it over here. Look, this is profunda brachial artery, which passes posterior to the humerus in the radial groove, and this you can see, this is the superior ulnar collateral artery, which passes behind the medial epicondyle, and this you can see, this is the